Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to share with you a model, if you will. I'm going to project it later on a screen for you all to see so that you get a visual. A model of emotional changes everybody goes through when they go through transition. I first came across this model in a book on actually how to set your goals, motivational type of books I tend to read. And when I saw this model by Kelly Connor, it immediately became very obvious to me how clearly it reflected the cycles, the emotional cycles of change all of you go through as you go through gender transition. Now, the model showcases the challenges people go through when they confront any kind of challenges, when they also set any kind of goals. So it's kind of like emotional roller coaster, if you will, of little signposts and stops that people tend to go through. Therefore, this model is highly applicable no matter where you're at in your life, because as you know, challenges are always something that we're confronted with, regardless whether it is related to our gender, or if it's related to our job, or if it's related to our relationships. Challenges are part and fabric of our lives. They're very essential part of our growth. So this model is for anybody who haven't even started their gender transition, for anybody who is in the midst of their gender transition, and for anybody who has finished, if you consider it finished, your gender transition. As I said, this model is going to be instrumental no matter where you're at in your life, because it's going to be highly applicable to any kind of challenges, any kind of struggles, any kind of big type of mountains you plan to climb. When I see this model, it helps me personally really understand and identify where I am in relationship to some of my challenges. And seeing and understanding cycles of emotional changes you go through is really helpful, because that way you can quickly understand and you can quickly identify where you land on a model. When you identify it, you can see what tends to, in a way, become an impediment to maybe completing and being successful, what also tends to become the most difficult times as you go through gender transition. So this model has 5 stages or 5 steps, if you will, that you tend to go through. And depending on your challenge, I think it's going to be very easy for you to identify where you're at on this model. So let's project the model on the screen. So as you can see, this is a very simplistic model. It's basically your very basic same old bell curve. As we can see, it demonstrates these 5 different areas that you tend to cycle through when you go through any kind of changes. So when you start our gender transition, I'm going to start at the beginning. So I'm going to apply this model to beginners, but obviously it's very applicable no matter where you're at in your gender transition. As you can see, when we start, whether it is gender transition, or maybe now you finished your gender transition and now maybe you are starting your relational life and you're starting dating, or maybe you're in the middle of gender transition and now you maybe are starting your surgical transition or something like that. No matter what we tend to start with, the first stage is going to be uninformed optimism. What does it mean? So uninformed, you're not fully informed, you don't have all of the information yet, and you're very optimistic. So your optimism is not fully rooted in reality, if you will. You're very optimistic because you're thinking about all of the positive, all of the benefits you're going to get with your transition, right? You're thinking about, and I'm not saying that you're in denial or you're being Pollyannish, but a lot of times you will disregard some of the realities of transition because you haven't experienced them yet. So while you do know from reading information, from maybe watching videos, from hearing others, you do know that people go through difficult times. You don't know yet that you will go through difficult times because you're not there yet. As a result, you are going to experience uninformed optimism. Everything is rosy in a way, so per se. All you see is the end goal. The end goal is your authentic self. The end goal is your authentic gender. The end goal is a sense of congruency and lessening of gender dysphoria. The end goal of living your life, having people around you seeing you for who you are. So in the beginning, we're inundated, we're kind of really saturated with optimism, which is usually really helpful for us, which is something that we do need, because that's what pushes us. That's what really creates that spark, that motivation to go to medical doctor, to get information about hormones, to start hormones, to come out at work, to come out to your partners. So all of this is really essential in the beginning and really, really important. But at start, it's Uninformed Optimism. And as you go, as you can see, you start really high. It's almost like a roller coaster, really high. And then you get a little bit later down. And now we're having informed pessimism. Sounds very Russian territory. My personality known to be for very realistic. People say you're like a realistic pessimist because you see things too realistically. This is my territory, informed pessimism. This is when now you're becoming informed. Now suddenly the high of the optimism has settled, and suddenly you are in the second stage of your transition of any kind of challenge. Again, this can be applicable to anything. And you're starting to realize, oh, it's actually not as easy as I thought. Oh, the changes on hormones are taking a while. Oh, now I'm feeling uncomfortable because I'm maybe having changes on hormones and I haven't come out yet at work, but people are seeing my body is changing and now I'm feeling tension. So now this is a part where you're starting to realize the reality of what it's going to take. Now you're realizing all of the things that may come with it. You're becoming more informed. And as a result of reality check, if you will, as a result of suddenly being so self-aware, you start feeling optimistic. You start questioning yourself whether you should be even doing that. So you start kind of feeling, I don't know if I can do this. I don't know if I can handle this. I don't know if I'm, set up for this. Maybe I made a mistake. Maybe I should go back. A lot of questions tend to come up at this stage of your emotional change cycle, if you will. So it's really important to recognize that this is normal. This is what happens when we get a dose of reality. The best advice I have for you, instead of getting so pessimistic, take the dose of reality and build on that reality. Realize that, yes, it is going to be challenging, and then identify which doses of reality are the most scary for you. Why are they so scary for you? If they're scary for you because you feel you don't have support, well, this is a really good intel for you to start getting your support before you get even further in transition. If this is really scary for you because you're realizing that your insurance doesn't cover surgery and you're going to need to finance your surgeries or surgeries that you really need and want, then start realizing, instead of getting pessimistic, how you can go about figuring those things out. How can you go about maybe saving, taking out loan, maybe changing jobs to get a better insurance, whatever it is that you need to do to make that goal become reality. So try not to get sunk into that pessimism. Reality often does feel pessimistic. When we start analyzing facts of what possibly can happen, they do feel pessimistic because it's suddenly such a big departure from our optimistic goals, our optimistic endpoints. So don't let it to really take away your dream. Don't let it take away where you actually had it. Take it as a signpost that's indicating, here's the reality, here's things you need to address. All it is just telling you things you need to address. Now, the third stage is the worst, the shittiest, the most difficult stage, and it's called Valley of Despair. I mean, oh my God, even the name, how perfect, sadly, how perfect applicable it is to what all of you going through who have been and maybe are right now in the Valley of Despair. If you've seen my videos, I often call this period as transition purgatory. This is the deep, I call it the deep, getting at the deep. This is kind of like one of those points in your transition where you are beyond that informed pessimism, and this is where you just feel like things are getting really hard. Usually the reason why you're in a valley of despair are going to be because you are not seeing results quick enough. You're not seeing your transition goals manifesting quickly enough. Either you're not seeing changes of hormones happening to you relatively quickly, or you're not seeing other things happening quickly enough. Maybe you're ready for surgery and you want to have a surgery, but what's happening is that your doctor, the doctor that you want to work with, is booked until a year or 2 years in advance, which are, by the way, a lot of really good skilled doctors are booked that far in advance. So now you're realizing that your goal, even though maybe you have all the resources, is going to take you that much longer to get to. So because there's now a time frame of reality of how long it's going to take you, you're in this valley of despair. And valley of despair, like I said, is the worst place you can be. This is not only where you're optimistic, but this is where you're confronted with hopelessness. This is where you feel like things are never going to change. This is where you feel like you're never going to pass, if passability matters to you. This is where you feel all of those scary things tend to come, plummet on top of you, and tend to catastrophize the hell out of your future. So valley of despair is the most challenging part. Again, this is also the part that I often describe in transition, where you hit the plateau, where you feel like nothing is changing. And what I always say is just wait. Just wait, just get through this period. Once you get through this period, changes start to roller coasting. A lot of time I say it's like popcorn starting to pop. Suddenly you're seeing the changes, suddenly things are happening. It does and it will happen, but you have to get through the valley of despair. So valley of despair, this is the time to get support. This is the time to reach out to get into therapy if you can. This is the time to even go online, at places such as Facebook and look for transgender support groups and join those support groups and talk to other people and say, hey, how many of you are in this place that feels like rut, that feels like nothing is changing? Sit through this period. Now, do you see why this model is so helpful? Because you can quickly now identify where some elements or some points of your transition are in the valley of despair. Now you can name it. And now you can also see, looking at this graph, that there are things that do come and happen after valley of despair. Valley of despair is not the final destination. Valley of despair, again, is not final destination. I promise you it is not. I know this, and I say I promise it to you because I see this so many times again and again and again. I see this in personal clients I work with, and I see this in the communities that made up of yourself and so many other people on social media who interact with me. So I see this all the time. I don't lightly throw away promises. And I know that people get out of the valley of despair. So sit through this. If you're able to sit through this and not give up, remember, this is a time of period where, because changes are not happening fast enough, a lot of you are start questioning, maybe I should go back. It was easier to live life with gender-assigned birth. A lot of you at this point will stop taking hormones, which is a lot of times I also say is okay, because if you stop taking hormones, what happens is gender dysphoria comes back, and it comes back even stronger because now you have a contrast. Now you're able to experience, or you actually had experience of being on hormones and lessening or completely alleviating gender dysphoria. And because you have this experience, what you're going to feel is gender dysphoria is going to be even that much more painful, that much more difficult to go through. So a lot of you sometimes do need to give up hormones to experience this, to confirm to yourself that I really have to do this because it's just not going to go away. So this is the valley of despair. Once you get through the valley of despair, now we have informed optimism. Now you're back again, optimistic. Why are you optimistic? Well, one, you've gone through valley of despair. Yay. Two, you're also now realizing that despair is short-lived. Again, yay. Three, you're starting to see changing happening to you. And because changing happening to you, you're becoming newly informed now with the knowledge of the process. If before you were informed, remember, informed pessimism is where you just informed about the facts of what transition entails, all the realities of the transition. Well, now you are informed because you yourself went through the experience of gender transition, you're going through the process, and because you're going through this, now it is relatable to you. Now you walked in the shoes, and now you yourself know that things do get better, the changes do come through, that all of those facts you knew about may and may not manifest. So as a result, you're feeling optimistic because the experience is personalized. Experience is now within the experiential field of your own subjectivity, and as a result, you are starting to really get to your own conclusions about what transition means to you. So this is informed optimism. It's a great place to be because now not only are you optimistic about the finish line, but you're also equipped, you're informed, you know what transition can throw at you, you have dealt with some of the challenges, you know how to overcome them, you know that there might be a future valley of despair, you know you're also going to come out from the valley of despair. So this is a really good spot. This is like a sweet kind of spot to find yourself in, because this is also where a lot of you become mentors to other trans people. This is where a lot of you start commenting underneath my blog post, telling others, when you see other people, actually when you recognize that they're involved with despair, this is where you start giving advice, this is where you start giving suggestions, this is where you give people tips, because you know you've been there. Now you're kind of your own personal experts in your own transition. It's a really good spot to be in because you're also stronger, you're more confident, and you're starting to valuing yourself as an individual. And then, of course, what do we have as you come out from informed optimism? We have success and fulfillment. This is where you finally reach your goal, whatever your goal is for you. For some of you, for a lot of people actually, transition is an ongoing process, meaning once you achieve the physical congruency you're seeking, there's an element of social post-living transition. There's an element of social where you're going through things and where you are learning how to navigate yourself in the world, learning how to navigate yourself in your authentic gender. So some people say transition is ongoing. But needless to say, this one big process of transition you have overcome, and now you are not only feel fulfilled, but you feel successful. And success not in the sense of necessarily you achieved everything you set out, or maybe things worked out exactly how you wanted them to work out. Success, what I mean by success at this point, is that you realizing your strengths, your perseverance, and your adaptability and your capacities to go through something so challenging. And that in of itself is a huge success, because that gives birth of a lot of sense of pride, and also feeling good about yourself. Transition is not easy. My hat goes off to people who go through this. My hat goes out to all of you who go through this, because it is challenging and it is difficult. But I do know, as you know, in the end of it, you are happy as a result of it. You maybe not necessarily swimming in a sea of joy 24/7, but you definitely are better off than before actually going through gender transition and living with dysphoria. So these are the 5 cycles. I want you to go ahead and take a screenshot of this model, pin it somewhere. If you're really struggling, try to identify where you are on this model. Try to remind yourself why you are at this point. Remind yourself that things do get better. Remind yourself that fulfillment and success is coming. It is part of this model for a reason. It is part of this model because statistically this is what people as human beings tend to go through. And it is there to illuminate to you that while valley of despair can be the most painful, the most difficult space to be in, it is not the end. It is not the end of the process. It's just this middle, nasty part, nasty deep, the purgatory period that is so painful, so difficult. There is life outside of it, but sometimes we have to go through this difficult period to get to a better period. So comment below, let me know where can you identify by watching this video where you at in terms of this model. Have you been through valley of despair, which is the most difficult part of the model? Share what helped you sustain valley of despair. This is again one where most people give up. This is where people will turn back. This is where people will sink into depression. This is where people really tend to struggle for a lot of understandably so legitimate reasons. So comment below, let me know where you're at, and especially help you overcome valley of despair, and I'll see you all next time. Bye.